My name is Dr. S. Indra, Assistant Professor, Department of Microbiology, Dhanlakshmi Srinivasan College of Arts and Science for Women. Today we are going to see about Ascaris Lumbricoides. It's a parasitic infection. It's also commonly known as roundworm, that is parasitic in the intestines of humans. It's the most common helminthic human infection. It is the largest nematode to infect the human intestine. It occurs worldwide, high prevalence in underdeveloped countries that have poor sanitation. It occurs mostly occurs during rainy months and in tropical and subtropical countries. The definite host of the Ascaris lumbricoides is humans or pigs. It does not have any intermediate host. Mode of transmission. It occurs mainly via ingestion of contaminated water or food contaminated with Ascaris lumbricoides eggs. Occasionally, it transmits through inhalation of contaminated dust. Children playing in contaminated soil may acquire the parasite from their hands, enhanced by the fact that individuals can be aseptically infected and continues to shed eggs for years. Period infection does not confer productive immunity. Morphology of the Ascaris lumbricoid egg. It's a fertile egg. It's have mammillated skin, thick external layer. It's unembryonated. And the measurements for the egg is 55 to 75 millimeter by 35 to 50 millimeter. Infertile egg is elongated and larger than fertile egg. Thin shelled. Shell ranges from irregular mammillations to a relatively smooth layer, completely lacking mammillations. Measures between 85 to 95 millimeter. This is the difference between infertile and fertile egg. Egg can survive for prolonged periods as long as it has warm, shade, moist conditions are available, and the egg can live up to 10 years. Eggs are resistant to unusual methods of chemical water purification. Eggs are removed by filtration and killed by boiling. Developing larvae are destroyed by sunlight and desiccation. Morphology of the Ascaris lumbricoides. Adult worm, its length about 15 to 35 centimeter. Female are larger in size and have a genital girdle. It is a microscopic examination of Ascaris lumbricoides. It has intestine, esophagus and mouth. It is electron microscopic view of Ascaris lumbricoides mouth. It is a life cycle of Ascaris lumbricoides. It enhances to the contaminated water. The egg enters into the human intestine, and female produce eggs that are passed in the host fecus. Juveniles in eggs mature to the infective stage. Eggs ingested by host and hatch in the small intestine of humans. Then the juvenile migrate to the lungs and it enter into the third stage juveniles. The third stage juveniles migrate from the pulmonary capillaries into the alveoli. The juveniles are coughed up and swallowed. The juveniles complete their development in the small intestine. Life cycle. Female lays eggs in small intestine and eggs are passed out through fecus. After 14 days, L1 larvae develops in eggs. L2 larvae develops after 1 week. Ingestion of raw foods, fruits or vegetables contaminated with Ascaris lumbricoides eggs will cause infection. L2 larvae penetrate intestinal wall, enter portal bloodstream, migrate to liver, heart and lungs in 1 to 7 days. Bore out of blood vessels and enter bronchioles, migrate through the lungs into the trachea, enter throat and swallow to end up in the small intestine. Mature and mate where they complete their life cycle. It is a life cycle of Ascaris lumbricoides. Food habits. The Ascaris lumbricoides feeds on the semi-digested contents in the gut of the human beings. Evidence shows that they can bite the intestinal mucous membrane of humans and feed on blood and tissue fluids. Symptoms of ascariasis. Migration of larvae in lungs and may cause hemorrhagic or eosinophilic pneumonia or cough, breathing difficulties and fever, complications caused by parasite proteins that are highly allergenic, asthmatic attacks, pulmonary infiltration and urticaria. Usually asymptomatic. Ascaris lumbricoides are usually asymptomatic. It causes abdominal discomfort, nausea in mild cases, malnutrition in hosts, especially children in severe cases. Sometimes fatality may occur when mass of worm blocks the intestine. Host immune response. Macrophage, neutrophils, and most importantly, eosinophils count increase during ascariasis. The worms would be coated with IgG or IgE, which would increase the release of eosinophil granules on the worm's surface. Adaptive immune response, general constitution of Th2 immune response with high interferon 4 production, high levels of IgE, eosinophilia, and mastocytosis. Diagnosis. Mostly Ascaris disease is diagnosed using stool microscopy, eosinophilia, imaging, ultrasound or endoscopic method. In stool microscopy, X may be seen on the direct examination of fecus. Eosinophilia can be found particularly during larval migration to the lungs. Imaging. In heavily infested individuals, particularly children, large collections of worms may be detectable on plain film of the abdomen. Ultrasound. Ultrasound exams can help to diagnose hepatobiliary or pancreatic ascariasis, single worms, bundles of worms, or pseudo-tumor-like appearance. Individual body segments of worms may be seen. Endoscopic retrograde cholicopancreography, a duodenoscopy with a snare to extract the worm out of the patient. Treatment. Mostly Ascaris is cured by using mebendazole, albendazole, pyrantel pameote, ivermectin, piperazine citrate or levamisole. Prevention. Prevention of reinfection poses a sustainable problem since this parasite is abundant in soil. Therefore, good sanitation is needed to prevent fecal contamination of soil. Mass treatments of children with single doses of mebendazole or albendazole helps reduce transmission in community but can cause reinfection. Thank you.